As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, US versus China, where I'll take you behind the scenes in the tumultuous US-China relationship. Find Face Off wherever you get your podcasts.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by Dr. Erin Faherty, who's a pediatric cardiologist who treats kids at Yale New Haven Children's Hospital. She also went to med school with my husband, Ethan, so this is a very special episode for me. So today we are going to talk about Miss C. The clock is ticking, so let's get to it. All right, Erin, so what is Miss C and how does it differ from COVID-19 in children?
So Miss C stands for multi-system inflammatory syndrome in children. And essentially, it's an inflammatory syndrome seen several weeks after a child is infected with COVID-19. Whereas COVID-19 infection is just that, it's the active viral infection. Miss C is a systemic whole body inflammatory response several weeks after the active COVID-19 infection. We say multi-system because it's just that, it affects many systems or organs in the body, including the heart, the skin, the brain, the GI tract, the respiratory organs. And so that's the multi-system part of Miss C. And the whole body is inflamed. And so every single one of those organs can also be inflamed.
So what are some of the signs and symptoms of Miss C in kids?
So Miss C typically presents with persistent and high fevers, usually several days, 2, 3, 4 days of fevers, and usually higher grade. And then Miss C can present a little bit different in every kid, but typical symptoms include rash, eye involvement, meaning kind of redness or conjunctivitis, we call it, of the eye, abdominal pain that can be associated with nausea, vomiting, diarrhea, and then sometimes shortness of breath, feeling unwell, not wanting to eat.
All right. So how concerned should parents be about Miss C, considering it's a rare condition? And what are some of the factors that might increase a child's risk?
So Miss C is fortunately rare. The estimated incidence of Miss C cases for children affected with COVID-19 infection are about 1 to every 3,000 to 4,000 documented COVID cases. And that was more at the beginning of the pandemic. The incident over the last year or so is even less. Most of the time, Miss C affects healthy children. So these are children without underlying medical problems. One risk factor studies have found is obesity. But we have found that certain racial groups seem to be more affected disproportionately than others. That includes Black, Hispanic, and Latino populations.
Okay, so with the rise of COVID vaccines in children, have you seen a change in the rates of Miss C among your patients? And then if so, how significant is the impact of vaccines in preventing Miss C?
So COVID-19 vaccines have significantly reduced the rates of Miss C. Unvaccinated children with confirmed COVID-19 have a higher risk of developing Miss C. Recent estimates are about 200 cases per million infections. And studies have suggested that reduced risk is 1 million in children who received at least one dose of the COVID-19 vaccine. So overall, we're seeing a much less incident of Miss C. And as someone who's taken care of a lot of these children, our number of cases has been much less over the last year or two since vaccines have been available. So although we are seeing less of Miss C cases, they are still occurring. Some of the CDC data from 2023 suggests that more than 80% of the Miss C cases were in vaccine eligible but unvaccinated children. And of those who had Miss C that were vaccinated, the thought is that they likely had waned immunity because they had received the COVID vaccine greater than 12 months prior to the Miss C.
So are there any specific recommendations for parents whose children have already had COVID-19 or MIS-C regarding future vaccinations? Should they go ahead and get the COVID vaccine as recommended?
Yeah, so when a patient has MIS-C or a child has a MIS-C diagnosis, they will follow with a pediatric cardiologist as well as a pediatric rheumatologist and work with them to determine when it's okay or when they get the green light, if you will, to resume COVID-19 or get a COVID-19 vaccination. For patients who had cardiac involvement with this MIS-C as a pediatric cardiologist, we often advise waiting 3 months, and that's just to allow the heart and the body to rest. But then after that, and once they get the approval from a cardiologist, we are encouraging patients who had a history of MIS-C and or documented COVID to continue getting vaccinated.
All right. So what I'm hearing is that overall, the research strongly suggests that COVID vaccines significantly reduce the chances of children developing MIS-C, which is a rare but serious complication following COVID infection. For children who have had MIS-C, vaccination is still worthwhile and safe, but is a decision that should be had with the child's physician, depending on the timing. All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Please leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.